Is it ethical for someone with a cluster B personality disorder to have a child? Hi, my name is Dr. Natalie Jones. I'm a licensed therapist. I have been counseling men and women who have been victims and or perpetrators of abuse for many years now. And I have a question from a commenter where I was talking about cluster B personality disorders, which means either borderline personality disorder, antisocial personality disorder, narcissistic personality disorder, or histrionic personality disorder. Folks that are diagnosed with that, and she's asking, how ethical would it be for a cluster B personality disordered person to have a child, given the chances of it being hereditary in some instances, and knowing the effects of children being raised in those environments? So that's a good question. And I don't know that I would put ethical, maybe use the word ethical, but maybe more or less moral. Is it for a person? How moral is it for a person who's dealing with a personality disorder to have children? And I think there's a difference between a person who has a full-blown cluster B personality disorders and a person that has, some of the cluster B traits. And you can also have a person with multiple cluster B diagnoses, so not just one. So I've seen people at the severe end of the spectrum. And I think, when you're a mental health professional, you have to talk with people realistically about their choices and their decisions, as well as their diagnosis. And being in working in the criminal justice system for many years, I've had to have a lot of conversations with both women and men about, childbirth, child rearing, and maybe even practices around sex and their behavior. And I can't tell you how many people I've worked with, mothers even, that have had to, leave their children behind and go and do some serious time, some federal cases and things like that, stuff where they're not getting out until their children, they may leave their kids when they're little or when they're babies, and by the time they get out, if they do, their kids are going to be, grown adults, and may not even know them that well. And so I think the way that I counsel people on this is I definitely educate them on what their diagnosis entails, how their behavior, just some of the things that I see, and how conducive is that for raising a child or raising children, just expressing some of my concerns, and then also assessing, how rational is that person right now, right? And, because sometimes people are not always thinking rationally. They just may be thinking for the moment, like, almost, sometimes, and I hate to say it like this, sometimes people think of children almost like pets. I want someone that's cute and cuddly to love for the moment, or this is a way to sort of commemorate my relationship with X, insert person's name, right? And so there's something to talk about that. But, I mostly come at it from a standpoint, and while yes, I may talk about hereditary stuff, so I may talk about intergenerational stuff, as well as how much work this person has done to tackle intergenerational stuff and what may be still triggering them. But I typically, what I like to do is focus on current behaviors in the moment. So if you're still committing crimes, if you were getting ready to go to prison for a long time, if you were actively using drugs and or substances which are teratogens, right? And I've had to counsel a lot of people that do that, right? Teratogens that actually affect your baby, how your baby forms in your body, and whether or not your baby could possibly be affected by their long-term drug usage. If you are a person that's in and out of the hospital, right, you are, wanting to harm yourself every other week, and so you're not stable. If you kind of have this behavior, well, I don't care if I kill myself or if I kill somebody else. There's some people that are like that. So really talking about the behavior and how conducive is that for raising a child, and then also talking to them realistically about what a child requires. So right now, I may say, right now you are unstable. Your condition, you're not stable. We're trying to work on getting you there, but you haven't been stable for a long time. And a child requires stability. You can certainly have a child being unstable, but you have to think about, like, if you grew up with an unstable childhood, do you want to repeat that pattern? So that may have questions like that. Is that a pattern that you want to repeat, or is that something that maybe you want to avoid doing? And I'm not saying that you can't have a child ever, right? I may put that sort of that modification. I'm not saying you can't have a child ever, but I'm saying maybe right now is not the time until you get stabilized, until maybe you get some medications on you, or you're just at a different place in life where you've shown a pattern of stability for at least 2 years out in the world on your own. And that stability may look like having a job, having a home, being off drugs, staying out of jail or prison, right? And not hanging out with questionable characters that are going to jeopardize that, just being on the straight and narrow and living a normal life. And for many cluster B personality types, normal life can be very boring, right? And so, I would want to see those patterns of stability, not just that, but also in your relationship, right? So I think you need to have stability in your relationship. So that means you can't be, running around with all these different partners, fighting your partner, getting into these volatile arguments where the police have to be called, those sorts of things. And so, and I also talk about, especially, which is especially true with cluster B, I often emphasize that a child comes before you. So many folks with cluster B traits or personality disorders can definitely be very self-centered and only thinking of self when they're going through emotional distress or inconveniences. So realistically, I say, you have to think of your child always. From now until the end of your days, you have to prioritize your child, because I'm a person that doesn't believe that parenting stops at the age of 18. So you always need to prioritize your child before then. And regardless of what happens to you and your partner, you always have to be a source of stability and comfort for your child. And we talk about like where they're at right now in terms of their social, emotional, and occupational functioning, and whether or not having a child is realistic, what it would entail. Like, here's what your social support network would need to look like. Here's what we would want to look at in terms of stability and things like that. So maybe these are the things that you would need to, be consistent with meeting, both for yourself prior to having a child, but you would need to show a pattern of stability in this way and this way. And we also lastly talk about medication management. What, if you're on any sort of psychotropic medications, what does that mean if you were to get pregnant? Because unfortunately, again, people have dual diagnosis, which means that they have more than one. So sometimes they can't take medications if they're attempting to get pregnant. And we would talk about whether or not that's in that person's best interest or how to manage that as well. And so I hope this helps to answer your question. This is a great question, and I really appreciate you answering that. Thank you so much.